Bismillahirrahmanirrahim. This is the first news on 31st January newspaper front page dawn. Pakistan secures 17 million doses of AstraZeneca. Special train set to leave for China to bring COVID-19 jabs. NCOC records over 2,000 cases, 65 deaths. Minister says vaccine is sufficient for 250,000 healthcare workers. Karachi paramedics attend a training session for the upcoming COVID-19 vaccination drive on Saturday ARP. These are the ladies on training, and you can see white and blue balloons, and they are going to have a session how to vaccinate the people, effective or not effective. Okay, 17 million. So now by Ikram Junaidi, Islamabad, with a special plane expected to depart for China in the next 48 hours to bring the post-trans of Sinopharm's COVID-19 vaccine, a special assessment assistant to Prime Minister on Health, Dr. Fazl Sultan, announced that around 7 million doses of AstraZeneca would also reach Pakistan in the first quarter of the current year. In his tweet, and the Prime Minister's AD said, happy to share that in addition to 500,000 doses of Sinopharm, almost 7 million doses of AstraZeneca to be made available in Q1 and given to the public free of cost. Pakistan's vaccine drive starts next week, beginning with frontline healthcare workers. The development was also cheered by Minister for Planning, Development and Special Initiatives, Asadumar, in his tweet, in which he stated that the government had received a letter from COVAX saying that 17 million doses of AstraZeneca would be provided to Pakistan in the first half of 2021. We signed with COVAX nearly 8 months back to vaccination drive, editorial on page 6. WHO team visits hospital that treated first confirmed COVID-19 cases in Wuhan, on page 10. Okay, ensure availability, the minister tweeted. Out of the 17 million doses, so 7 million will be available by March. Dr. Fazl Sultan, in his statement, said, we are pleased to announce that the government of Pakistan through COVAX facility has secured 7 million indicated doses of the AstraZeneca vaccine out of which 35 to 40%, 6 to 6.8 million doses will be available within the first quarter, and the rest in the second quarter of 2021. He said AstraZeneca had already been approved for use by the Drug Regulatory Authority of Pakistan, DRAP, adding that distribution of the vaccine was likely to begin in February. COVAX timely support and delivery of the vaccine is a testament of global stakeholders' trust in Pakistan's preparations for vaccine rollout. Preparedness for vaccine rollout. We remain confident that we will meet our plan of large-scale immunization over the coming months this year, Dr. Sultan added. An official of the Ministry of National Health Services, meanwhile, said the efficiency rate of Chinese Sinopharm's vaccine was around 80%, but Oxford AstraZeneca's efficiency was recorded 90%. Though AstraZeneca is being prepared in India, it will come through COVAX, an international alliance with which has announced a free vaccine for 20% of Pakistan's population. DRAP has already registered both Sinopharm and AstraZeneca, the special assistant said. Talking to Don, Asadumar said the special plane was all set to fly to China to bring 500,000 doses of the vaccine. He said the next tranche would arrive before the country utilized the doses from the first consignment. According to the National Command and Operation Center's NCC statement, the forum on Saturday deliberated at length on the vaccine administration strategy and necessary measures, particularly logistics. All necessary measures have been put in place for vaccine storage in Islamabad and its transfer to other federating units, particularly Sindh and Balochistan by air, the statement said, adding that the vaccines nerve center had been established at the NCOC. Mr. Omar said the Chinese vaccine would be sufficient for 250,000 healthcare workers, as 2 doses were required for every person. As 400,000 healthcare workers have registered themselves, it has therefore been decided that instead of considering the population of the federating units, the number of registered healthcare workers would be considered before dispatching the vaccine. In this way, the vaccine can be dispatched for 30%, 40%, or 50% of the registered healthcare workers, he said. The minister said, as it would take 2 to 3 weeks to vaccinate healthcare workers, and was hopeful that the new consignment would arrive before its utilization. He said the second consignment could arrive from China, but as negotiations were underway with multiple sources, it could also be expected from another country. Replying to a question, Mr. Omar said it had been decided to transport the vaccine to Punjab and Khyber Pakhtunkhwa by road and to Balochistan and Sindh through air. On the other hand, an official of the expanded program on immunization, EPI, said vaccine availability had been made possible because of EPI's efforts in ensuring development of a second vaccine deployment plan. It was a race against time and the collective hard work of federal and provincial API teams has made it possible, the API officials added. Meanwhile, the NCOC data reported 2,183 new cases and 65 deaths from COVID-19 in a single day. It further said 296 ventilators were in use throughout the country, with the vent occupancy rate in Islamabad recorded at 38%, followed by Multan at 37%, Lahore 35%, and Peshawar 25%. The data on beds providing oxygen showed that Peshawar was utilizing 41% of the beds, Karachi 35%, Multan 34%, and Rawalpindi 24%. The number of active cases in the country has been calculated at 33,439, with 2,566 patients admitted to hospitals. And in the end, if you have not yet, please subscribe our channel and press the like and bell button to get the press from us. Thank you for watching. Have a nice time and goodbye.